The post-COVID era has seen a meteoric rise in the number of sex tech startups and healthcare startups. In the same time frame, a very interesting company entered the Indian landscape. Allo Health is a company that's working towards normalizing sexual wellness. And today, I'm thrilled to talk to the founder of Allo, Pranay Jivrajka, who is the man behind all of this. Hi, how are you doing today?
I'm doing good, Atika. How are you?
I'm good as well. I'm so excited to have you here, and I've read so much about Allo. So I think where I want to begin from is that I know you were at IITB and then you were with Ola for a very, very long time and a very core part of the company. And from there to the healthcare space, how has your journey been and what has it been like?
No, I think thanks for having me here and thanks for asking this question. A lot of people have asked me, why, shift from mobility to healthcare and,
Yep.
How is this different? It is obviously different in many ways. But I think at Ola, I spent almost a decade, a third of my life, most of my professional experiences there, and whatever I've learned, and I've had a great experience out there. But with Allo, one thing which is different is the depth of the impact, right? So Ola had, it gave me an opportunity to create and be a part of something which impacts like tens of millions of lives.
Right.
Allo is a very different spectrum, end of the spectrum where, we have life-changing impact on the lives that we touch, right? And this is what healthcare has the potential to offer you. And this was an exciting space to be in.
So I think just how Ola became the household names for traveling, let's say, is Allo going to be that for sexual wellness in India?
Like normalizing conversations around
Right.
sexual wellness is one of the goals that we have at Allo, and I think that would regardless of whether Allo comes into the picture or not.
People who are experiencing sexual health concerns seem to not have a reliable place to go to.
Yeah.
How do you feel about the pre-Allo experience in the sexual healthcare space, and how will Allo change that?
No, I think that's a very interesting question. And I think, around last year, when we were researching about, what are the consumer needs, how does the doctors get patients, talk about what are the conversations around. And, in this entire thing, I happened to get a deeper understanding of the ecosystem.
Yeah.
And realized that if I have a sexual disorder, let's say if I have erectile dysfunction as an example, I have no reliable means to understand, learn more about it, and then figure out, what are my options for solutions around it, right? So, and this is at multiple levels. So I'll start from me accepting the fact that I have an issue. I think that itself is like the first step, and it's a very major step where you acknowledge the fact that there is an issue and you probably need help, right? Now, when it comes to help, the first thing that we do in today's world is, go online, look it up on, YouTube, Google, and it has a lot of information. And the problem is that it has a lot of information, right? As someone who is just insecure about your problem, you don't even know कि कौन सी चीज़ इसमें से सही है और कौन सी चीज़ गलत है, right? And I have seen videos with millions of views, which are, giving, unscientific, not science-backed information, which is wrong, but as a user, a lot of people watch them, practice it, and then, it further adds down to the insecurity that they have, कि यार मेरे में ही कुछ problem है, it's not working. And then, the other challenge is because of the stigma and because of the way, we have been in the society, we don't discuss it with anyone, we don't discuss it with our siblings, even with our parents. And you will be surprised to know that, even with our partners, we discuss it only on a need basis, right? There are Guptro clinics. I'm sure, if you have traveled to any city in our country, over a train or bus, you would have seen those big boards and, wall murals which talk about how can, a quack help you solve for your, problems. And as a country, I think it's very unique for us that we have more than 70,000-80,000 Guptro clinics spread across, be it Mumbai or Aurangabad or Tamil Nadu or Asansol.
Also scary.
It is, right? And I mean, if we get time, I'll share my experience with a Guptro clinic, and it is very scary. I think अगर problem नहीं भी होगा तो if I go there तो मुझे हो जाएगा, right? So that's how it is. And it is more hope-based treatment, right? I mean, I am sure half of the people who go to those clinics, they go there because they don't know where else to go. And, it's a more hope-based treatment कि मुझे पता है कि यार ये there's no science behind this, but let me try this, right? Because I've tried so many other things and it has not worked, so why not this as well?
Yeah.
But I think in reality, what we really need is, better access to quality healthcare in the sexual wellness space, right?
Yeah. I mean, so from what I understand, the whole complete Allo package, everything it includes, from information to even some tips and tricks you can try out on your own, expert consultation, is backed by science.
Absolutely,
I think that's a key point to remember, because you're absolutely right. Most of the people are either self-medicating, self-treating. Of course, there are Guptro clinics, etc. And that's what needs to be replaced, essentially. Like, that's the vacuum in the sexual healthcare space.
Yes, absolutely. And I think if you go further, if you go one level deeper to this problem, you will see that the fundamental problem sex education ka hai, right? I'll tell you my example.
Yeah.
I was in class, when I was in 7th grade, there was a social science chapter which said how life begins. And, my class teacher asked all the boys to go out and play basketball. And I happily played basketball. And, after the session got over, and we never came back to that chapter. And I clearly remember, it had all the diagrams of, the anatomy of a male and a female. And that was my version of sex education that got, that I got in my school days. I don't know how it is today. But fundamentally, whatever understanding that we have is out of our own experiences or out of, the pornography that is available now in plenty.
Right.
But I think the very basics of sex education can solve a lot of these myths and insecurities that people have around their bodies, around their practices. People take a lot of inspiration from what they see in pornography, and that is like two different worlds. So I think if we solve for that, half of the problems probably will get, are not even problems, right? And then, the other half we can, get experts to help us and solve.
I mean, very correctly put, that the gap in sex and sexuality education is where it all begins, and then it kind of multiplies over the years. And that is actually the second problem Allo is solving for. When we say normalizing conversations around sexual wellness, this is to say that this is something that should be talked about. This is something that should be taught also. And I think you briefly mentioned something about medically vetted content, and content is everything in today's world, right? But going beyond content and going beyond doctors' consultations and the healthcare core activities, what are some of the things Allo is doing to normalize sexual wellness? And, Allo being one of the agents of change, of course.
Yeah, I think the most important things that we are trying to do is, have content that you and I can understand, because we are not WebMD readers. And, it is done in a way that, it's accurate and something that I can consume.
Right.
Beyond that, we have a bunch of initiatives where, you can anonymously ask your queries or questions. So we have a section called Ask the Sexpert, where, you can ask anything that you want to ask about, any concerns that you have around sexual wellness. And, within a few hours, one of our, in-house experts will answer that. And, so the idea is to create a source of truth on the internet and make it available and accessible to everyone.
Yeah, and you're doing it free of cost.
Yeah, and it is obviously free, right? So I think that source of truth will be the source of sex education in many ways for a lot of us, and, solve for a lot of these problems early on, and a lot of confusions and myths that people have pretty early on in their journey of, solving for their sexual disorders.
I think I want to take it back to where I started from. I was thinking about and talking about how the sex tech and health tech space has almost suddenly come up in the post-COVID era, when telehealth consultations started, all of that. And there are so many companies that we know of in India, abroad, of course, but also in India. But when I think about sexual health and wellness specifically, there isn't any, actually. Allo is the only company doing this, right? Like, there are companies who are dabbing into reproductive health. There are supplement companies. But Allo is actually the only one that's saying that, okay, this is a stigmatized topic, but we'll take responsibility. So what is your take on that?
Yeah, I think, like you said, right, we are at the end of the day, we are a healthcare company, right? It's a digital clinic, which exists because it should exist, right? And, there's no one who's talking about the sexual disorders, which is like a very strong precursor to fertility issues, which is like a big thing in our country. The real problem is the ecosystem being underdeveloped, right? Now, this is sexual disorders is not something which is attractive to anyone in the ecosystem today, right? The hospitals, for all the right reasons, they have a business model which does not support just OPD centric, which is just the consultation, and there are hardly any surgeries in sexual disorders, right? So it's not a very attractive proposition for hospitals. Doctors, on the other hand, who run independent clinics, and there are a few doctors who do it like really, really well on the sexual disorder space. But most of the doctors don't want to get categorized themselves as a sexologist, right? Because they feel that it will impact their other part of practice and will get tagged as one of the people who do Guptro clinics, and there are multiple stigmas associated with this, right? As a doctor who has done MBBS, even if I am excited about this space and I want to pursue my career in this space, or get more education in this space, it's very difficult because there are hardly one or two institutes who actually offer courses on sexual medicine.
Right.
And so I think if you go back, to hospitals karte nahi hai, clinics mein doctors karna nahi chahte hain. If I am a MBBS student or if I am a doctor and want to further specialize, I have very few opportunities and very few institutes for that. So it's a vicious cycle that has been created. But on the other hand, if you look at it, there is so much of need and demand for this kind of a service, right? And that gap is fixed or kind of filled by these Guptro clinics, alternate medications, OTC industry, and I hope it solves some of the problems. But I think what we need is like a holistic solution, and there's a clear white space that we identified and thought is super impactful and like I said, life altering for people who go through the intervention.
Yeah, I definitely think that it is the right time, if there were any, for people like you and your team to be in this space, who are so passionate about it, who are working to deliberately pull out the stigma and not working around the stigma, which is what we've seen a lot. But if I were to ask you, and maybe I'm asking this too early, but if I were to ask you, how do you see Allo in the next 4 to 5 years?
So I think I have a very clear understanding of how I would want the sexual wellness space to be, and I would want Allo to play a significant or a significant contribution to that, right? So I think a few years down the line, what would be ideal is pornography is not the means for sexual education. Conversations around sexual disorders should be normalized, and there are enough and more opportunities for people to come out, speak for their concerns, and get the right recommendations or guidance from the experts. I think this is what we need as a country, and whatever is required to do and whatever Allo can do in this is something that we would want to do.
Yeah, absolutely. What a wonderful way to kind of put that. And this also brings me to the end of our chat today. And it's just been lovely talking to you and understanding really why Allo is what it is and why you do what you do. And it's been extremely interesting for me to find out. I hope everybody who's watching has also understood this. And if you have any questions, you can drop them in the comments. And until then, this is Pranay and Artika signing off. And we do hope to see you again. And you can also check out the Allo Health website, which we'll link in the description below.